Hello, welcome to PPP Today. Our focus is on the just recently launched new health and services profile for Nigeria. Earlier this month, the Nigeria Country Health System Services Profile was unveiled. It is the first full edition under the African Health Observatory Platform and was developed by the Health Policy Research Group of the University of Nigeria Nsukka, Enugu State, Southeast Nigeria, with support from the Federal Ministry of Health, the World Health Organization Africa, and other international organizations. The purpose: to give a hard evidence-based look at Nigeria's health system performance, what works, what doesn't, and a guide to reforms. According to the profile report, there are some challenges. First, Nigeria's health system is operating at 45% of its potential, which is fairly lower than the African regional average of 56%. Private providers deliver 70% of all healthcare services, while around 80% of public health infrastructure needs significant upgrade. Out-of-pocket spending accounts for 75% of all health costs, while on the workforce front, Nigeria has minus 3.95 doctors per 10,000 people.
I think part of, to make sure it doesn't help, end that way, is we have to keep promoting it, with we have distilled into smaller policy briefs, and then you heard the director here representing the minister, and I think we also have a minister who talks a lot about evidence. So I think a lot of political will is there, but I think it's for the press. It's not just for the press, because people listen to the press. It's for you to also to help to broadcast this information, to make sure people know about it in ways they understand. And people, both policymakers, National Assembly, we highlight some of these things. We are not working the way we are working. We are performing at 45%, Africa is 54%. 75% is funding is from out of pocket. So I think it's everybody. That's why we also have civil society here. But I think for us, we'll have to keep engaging, providing evidence, and then talking with the press, because I think the press is quite important to make sure things happen.
If people start demanding for their rights when they visit a facility or when they don't have the services they desire, then government and the service providers will sit up. That's number one. Number two, they also need to ask for, as part of their rights from the people that are representing them, the legislators and all that. One key thing, one common problem is that people just, whatever problem they have, they just go, they resign to it.
Despite these challenges, the federal government says it is ready to remedy the situation.
In this era, where policy decisions must be grounded on robust evidence, this country profile serves as an indispensable tool. It holds up a mirror to our health system, showing us not what we wish to see, but what actually exists. This profile framework will allow for comparative analysis and facilitates the sharing of best practices across our continent. Nigeria stands ready to learn from the successes of our peers, while also sharing our own innovations and lessons.
The Nigeria Health Sector Renewal Investment Initiative and the sector-wide approach launched in 2024 are part of that response. Insurance enrollment has grown from 16.7 million to over 19.4 million in a year. The Basic Healthcare Provision Fund budget rose from 80 billion naira in 2024 to 298.42 billion naira in 2025. There were some recommendations. First, there is the need to scale up public health financing, strengthen regulation and oversight of private providers, improve infrastructure and maintenance systems, expand health insurance coverage, retain and motivate health workers, boost local pharmaceutical production, build interoperable digital health data systems, enforce accountability and anti-corruption frameworks, deepen cross-sector collaboration through public-private partnerships.
So as a country, we now have that clear definition and how the references that we want to adopt to continue measuring our performance performance. And importantly, I think, especially in the last bit of the chapters that talks about the coverages and what it will be helpful. And because of the close partnership that you've worked with the DHPRS, my assumption is you've standardized those definitions so that as we continue to move going forward, we can always, whatever we have, we can continue to measure our progress together, not having different set of data, different metrics.
We see this as the first of a number of profiles we're producing as part of the platform. We have another one on Ethiopia coming out very shortly, and then others on Rwanda and Senegal and Kenya, all coming soon. They offer a point to look comparatively at health systems across the continent for us to learn from each other, both within the continent and internationally. And we hope that Nigeria leading the way in getting this profile out, as always.
Although there are still challenges in Nigeria's health system, the report offers a clear path forward. With government, civil society, academia and citizens working together, Nigeria will definitely climb from 45% to 80% capacity within a decade. And on that optimistic note, we end this edition of PPP Today. Don't forget to like, share and subscribe to this channel, not forgetting our social media handles and of course our website. That's www.von.gov.ng. Till next time, bye for now.